All right, guys, this is Josh and Tim with Medicare Mojo, and today we're just going to be going over the basics of Medicare because a lot of people, Tim, are just super confused about how Medicare works. They think, oh, I went to this website, or I saw this commercial, or I spoke to this agent, and they're constantly given the wrong information. So let's just go over the basics with them and see what happens.
Basics are very simple, and if you're speaking with the right person that can lay it out for you, it's really not that complicated. Basically, you're looking at taking Medicare A and B as your base. That's your foundation, all right? And putting it in layman's terms, Medicare Part A is going to cover you at 80% for everything inside the hospital. Now, that does have a deductible. It has no premium. You're not going to pay monthly for Part A, but it does have a deductible of $1,632 every 60 days. That resets every 2 months.
Cool. So, the whole purpose of this video, I just want to make sure that, it's just kept super simple. Because the reason that people... If you haven't gotten your copy of the Medicare Cheat Sheet, by the way, you can go to MedicareMojo.com. Just go right there. You can get the cheat sheet. But a lot of people, they just want it broken down super simple. At the end of the day, if you are someone... Now, listen, if you're on Medicaid, then you should take an Advantage plan. If you're on Medicaid, you take an Advantage plan. If anyone disagrees with that, drop it in the comments. We'd love to debate with you. But anyone that's not taking an Advantage plan, or not on Medicaid, rather, should be taking a Medicare supplement plan. Now, obviously, people are always going to say, well, a supplement plan costs money. Yeah, it costs money. It also costs a lot more money if you're not on a supplement plan and you're on an Advantage plan, because what's the cost of being able to go to whatever doctor you want? Is that priceless?
Absolutely not. No.
Right. What's the true cost of not having the right amount of coverage and having to come out of pocket more money if something serious was to happen, which is the whole reason you have insurance? If you have to go to a doctor that you don't want to go to and it ends up costing you more and the whole experience is worse, I guess, yeah, cool, it's free. Not really,
Yeah, you can't put a cost on those kind of things. You don't know what your health's going to look like over 65. You don't know what your health's going to look like under 65. So who knows? There's not a limit on how much you could come out of pocket if you're not on the right insurance.
Yeah, this is not like looking at a car, right? If you drive a $50,000 car and total it, you're out $50,000. If you injure yourself, you can't replace yourself, right? So insurance is always worst case. The thing is, if someone comes down with something very serious like cancer or something just bad, I don't want to talk about diseases on this, but if someone comes down with something really bad, you will be screwing yourself over with an Advantage plan. The stats prove it. You're going to have a worse experience. You can't go to which doctors you want to go to. They're going to make you get authorizations. It's terrible.
You know what's crazy, Josh?
Yeah.
If you really take a moment and look at the outline of policies, which every single policy with Medicare is public information. You could look at all this information on Medicare.gov.
Yeah.
But if you take the time to go in and look at those policy details, chemotherapy drugs, dialysis, Part B medications, 20% coinsurance on each one of those things. And nobody's notified of this. Nobody's told this. It's left up to you to do your own research.
Yep. So if someone was taking... Say someone's, most of the people that come through and get this cheat sheet that come through and schedule calls with us and talk with us, they're turning 65. They're within 6 months of turning 65. The perfect map, to settle all this, when you turn 64 and a half, you take your Medicare supplement plan. You set that up, okay? You can't take your A and B yet because you can't do that until you're 3 months away. So the perfect path for someone to take, just to we'll map it out and then we'll go over it. You take your Medicare supplement plan, either a Plan N or Plan G. If you have health issues or you want to make sure you have the right protection, you take a Plan G. If you want to save a little bit of bucks, get a Plan N. You then, 3 months from turning 65, you get your Medicare Part A and B through Social Security. The price for 2024 is
$174.70.
$174.70. Okay. From there, you then take a Part D, which is for your drugs and prescriptions, if you take any, and then you're all set. Then you have 100% coverage. You never worry about a medical bill again. If you take a Plan G, you never worry about a copay again, a deductible again. You just have your Part B deductible, and that's once a year, and that's the only thing you ever pay. You can have terminal cancer, live in the hospital 365 days a year. You pay less than $300 plus your premium.
Absolutely. So I feel that is a huge thing that people overlook about these policies. They look at it at face value. They say that's a couple $100 out of pocket a month. But what they fail to see is that is all you're paying for anything that happens to you down the road at some of the best facilities in the United States that you could possibly go to. Yeah. You are still paying that same amount.
It's crazy. Why do we have to explain this to people?
It's wild, but I feel like it's just because the information's not out there and people just don't know.
Yeah. I mean, let's talk about the path of Medicare Mojo and what we've been on, right? So I've been in the insurance space since 2011. 2011, 2012 is when I started learning about it, getting licensed, and then hopped into it. You got licensed not that long ago. Not, you're also a lot younger than me, but we started MedicareMojo because we just kept getting so many people on the phones from, people that we helped out with Medicare. And they're like, hey, you guys should make a social media channel and really teach people the right way to think about this stuff. Because, dude, the government, the politicians, when they go in the office and make like $200,000 a year and then they leave 30 years later worth $100 million, that's through Medicare Advantage. It's because they're stealing all these benefits and then they just siphon the money off in whatever offshore bank accounts they have. They want you to take an Advantage plan. It's disgusting, bro.
It's absolutely true. And there are so many articles. There's so many things you can read backing this up and showing you the actual numbers. Because, again, everything they do is public. They just make it very hard to find. So there are articles. There are things you could read that will show you proof of this information. These politicians are just dipping into the Medicare money, and they're just spending it on whatever, and not your health claims, that's for sure.
It's crazy. So, at the end of the day, they're like, you have to take an Advantage plan. You have to trade this. The thing that people don't realize, when it comes to Medicare Advantage plans is, number one, it's not Medicare. That's the craziest part to me. Like, they think, oh, I'm on Medicare. You're not on Medicare. You took a Medicare replacement program. That's what Part C is, okay? The fact that the government actually allows this to happen, it's because they're making money off it. Like, not the government, but the politicians are making money off it. It's not debatable. It's happening. At the end of the day, it's like, why would they not want people to get the coverage they want? It's because of money. There's only so much money that these carriers are given to take on the obligation to cover these people. So if Aetna or Humana is getting $900 a year to cover you, and you cost them $1,000, get out of our insurance company. You're costing us money. We're supposed to be riding around on private jets, and you're costing us money. So, bye, Tim. Go find a new policy. That's literally what they do.
It is absolutely what they do. And a lot of these policies, what they'll tell you whenever you're enrolling, that's the biggest issue is when you're enrolling, they do not tell you that you're replacing your Medicare.
Nope.
They do not show you what your out-of-pockets are going to be.
Nope.
They tell you zero copay, which is only half true. If you go in and look at the outline of these policies, your copay for, let's just use an MRI, for example, will say zero, and then it'll have a hyphen, $450. So you're paying anywhere from $0 to $450 for that MRI. So what you're going to be paying depends on how much the insurance company is making or how much they're losing.
It's disgusting.
It's wild. It blows my mind that they're not even required to tell you this information.
Yeah, and they really should be. But, so let's just recap on this. If I was turning 65 and I was very confused about Medicare, I would want someone to tell me the exact way of doing this. So here's how you do this. You take your A and B from the government. That's your Social Security. Your Social Security pays for it. So you take your A and B from the government. You take a Medicare supplement, either a Plan N or Plan G. You pair it up with a Part D, and you get a private drug or prescription plan, and you get a private dental, vision, and hearing policy, and then you're all set. You just collected all 4 trading cards, and you have unlimited superpowers for the rest of your life. It's that simple. When it comes to Medicare, though, they have a handbook this thick. Ours is 6 pages, 7 pages,
somewhere around there.
So to tie it all in, how we started MedicareMojo is people kept asking. Me and Tim took our knowledge of what we knew, started making a social media channel on TikTok called MedicareMojo. It was going to be called Medicare Guidepost. That was what we were going to call it. And then I was just like, MedicareMojo, I don't know. Google MedicareMojo. It's kind of like, what does it really mean? But who knows? But it sounds good. And, at the end of the day, I think it actually means something now because we're giving people their mojo back.
Yeah. Absolutely.
Dude, the confusion around healthcare before I was an insurance agent, and my workplace at the time did not offer insurance, it was hell.
Yep.
HR didn't know anything about it. They're like, just contact this person. That person didn't know anything about it. I was just coming off my parents' insurance at the time, so I'm like, pay for insurance? I thought insurance was free, because I always got it through my parents. So no one told me, right? So it's crazy that more people aren't informed of this stuff. But like when it comes to like this cheat sheet, for instance, we literally dumbed down the entire thing into 6 pages. So you know exactly what's going on with Medicare. It's really not that confusing. A lot of people are like, oh, but I'm on a limited income. I can't afford a Medicare supplement plan. Well, if you're on a limited income, then you should limit the amount of risk that you have to your income, your assets, everything you worked for your whole life. Like people want to pick up pennies in front of steamrollers these days, like not getting the right insurance. The cool thing is, if you were not already backed by what you put in the Medicare for your health insurance at 65, you'd probably be paying $3,000 a year or a month.
For this kind of policy, absolutely.
My family of 3, I mean, dude, we're all healthy. We're all, like barely above 40 with a 6-year-old, and we pay $1,300 a month for an $18,000 deductible.
Yep. That's about how mine looks for my family.
And it's cheap. Well, yours, I don't know how yours is that much. You're younger than me.
Mine is not that much. The coverage looks about the same, but mine costs close to, for me, my wife, and my son, close to about $500 a month.
$500 a month ain't bad.
It's not terrible, but it's definitely not the level of coverage that you get with Medicare and a supplement. Absolutely not.
I mean, when I get my Medicare supplement, I'm going to make a reason to go to the hospital. It's free. Doesn't cost anything.
Absolutely. I mean, I tell people after I set them up, I'm like, look, anything that you've been putting off, waiting to go do it. Go do it now.
Yeah, absolutely. What would you say? You take Tim is Tim's more client facing, so he's getting on the phone with people that schedule calls with us and want us to kind of consult with them and help them fix their Medicare problem. What would you say is some other things that hold them back, or confusion? What confusion do they have on the phones?
Normally, the confusion's cleared up in quite literally 5 minutes. It does not take long to really get you where you need to be.
Yeah.
But one of the biggest issues right now is trying to explain to people exactly what the Advantage plans are and how they even replace Medicare A and B, because nobody knows this. I talk to people. I'm talking about lots of people on a daily basis about this stuff. Nobody I have talked to yet, unless you've watched MedicareMojo, know that these Advantage plans are replacing your Medicare A and B. And it's a huge problem. And that is one of the biggest hurdles, is trying to explain to somebody, hey, you do not want to replace your federal insurance with private insurance, especially not when you've paid into your entire life. One that's going to be $0 a month, but charge you nickels and dimes the entire time you're on the policy and tell you where to go. These policies are made out to be the best thing ever. They're literally even called Medicare Advantage plans. It's not Medicare. It's not an advantage to anybody. It's not a Part C. It is a private insurance company that is replacing your insurance. So
Crazy.
That's the biggest hurdle to overcome. But again, normally that's done in about 5 minutes.
How does the government let this happen? How, man? It's really crazy. And honestly, I feel very, very bad for people turning 65 that are this misinformed, especially because once you go a year past you taking your Part B, if you have any pre-existing conditions, you are screwed. You are not getting insurance from a Medicare supplement plan. You'll always have to go through underwriting. They have all underwriting is saying, hey, is this person going to be profitable or unprofitable for us? And if you have pre-existing conditions, you will definitely be unprofitable for them, and they're not going to take you. So get it while they're forced to take you. When there's no underwriting, you have guaranteed issue. We teach people in this to do it the right way. You read this, you learn a little bit about it, you schedule a call with us, we charge you nothing, you get on the phone, we help you enroll. It's that simple. I don't know. I mean, maybe people are just scared of us because we actually do what we say we're going to do. It's crazy. I mean, there's a lot of scams out there. There are. When people call, be like, how do I know you're not a scam? Well, how do you know we are a scam? If we knew as much as we do about Medicare and we actually were a scam, we'd be the dumbest people on earth. It's like you have enough knowledge to do it right, but you just don't do it right. Yeah. People really think that that's who we are, which, you're going to have haters no matter what you do. So
absolutely. Anybody that's ever gotten on the phone with us, it's like that. And they realize, oh, wow, you guys are actually doing what you say. You teach, or what's the saying? Practice what you preach.
We do practice what we preach, yeah. Who's our biggest fan? Kevin
Elmer.
Kevin Elmer.
He's on the TikTok. I'm going to have to let him know.
He 100%. Kevin, if you don't leave at least a smiley face emoji in the comments on this YouTube, since now we're here on YouTube, yeah, man. Well, I guess, this is the first episode. So, me and Tim really thrive off of your guys' comments. When we see your guys' comments on the TikToks or on the Facebooks, it inspires us to make more and more content. And, so what videos would you like us to make? We can only make 60-second videos or 2-minute videos on TikTok until it just doesn't make any sense anymore to do it. But we're going to start making longer and longer form videos here on YouTube. We know that there's a lot of people that need help. We see a lot of false information here on YouTube, not calling anyone out, but we see a lot of false information. And, we pride ourselves on just telling you exactly what you need to hear. Are you going to have to spend money for your health insurance? Yes. We didn't invent how the world works. We just kind of grab your hand and say, we know the proven path to getting you the best coverage for the best rate and put a smile on your face. And I'm pretty sure that's what every consumer wants.
Absolutely. We're all in the same boat. We all just got to learn to paddle together. That's all it is.
That's it. So down below in the comment section, if you like this, if you've been a fan of Medicare Mojo for a while, if you've been just seeing us here for the first time, drop some comments. Let us know what future videos you want us to make. And Medicare Mojo is now live on TikTok or on YouTube. And yeah, man, less than a year in, we got 70,000 social media followers. We got a content studio now. We got a new and updated cheat sheet. Yeah, man, I think this is going to be a good year for us, but more importantly, our clients. That's why we do good when the clients do good.
Absolutely.
Yeah. Cool. Awesome. Anything to end with?
No, not really. Just follow the page. That's
The
about
page.
it.
How do they find us?
Follow the channel, and
How do they find us?
You could quite literally find us anywhere. You go on TikTok, you can find us by just searching Medicare Mojo. You go on Facebook, you can find us by searching Medicare Mojo.
That's right.
Put Medicare Mojo in Google, you're going to find us.
Yep. Cool. Awesome. Well, everyone that's been a supporter or a hater of us over the last 8 or so months, we appreciate you either way. We'll see you on future videos. I'm Josh.
And I'm Tim.
Talk to you soon. Cool, man. Dude, we'll just post it and see what's good. Like, that's the thing. Like, I don't try to, like, be like, oh, we have to make it perfect. You know?
Yeah, well, that's normally how I do some of my videos.
Hit that. Hold this down.